Kay Brown is the Director of GAO's Education, Workforce, and Income Security Team and more than 30 years' experience in GAO. She is responsible for GAO's work related to child welfare, child support, domestic nutrition assistance, among other social programs. Throughout her career at the GAO, Ms. Brown has managed projects that focused on improving governmental performance in services to children and families, disability and retirement, benefit delivery, and customer service and program integrity. She is accompanied by Cindy Ayers, Assistant Director for Education, Workforce, and Income Security at the GAO.
Chairman Miller and members of the committee, thank you for inviting me here today to discuss our work on residential programs for teens. This morning, you've already heard a number of heart-wrenching examples of individual cases of abuse and death in residential facilities. Now, I'd like to try to shed some light on what we know about the national picture. To clarify the difference between our work and the case studies that you heard, my remarks are based on our ongoing work. Over the past year, we conducted national surveys of 3 separate agencies in each state: child welfare, health and mental health, and juvenile justice. Each of these state agencies may place youth experiencing behavioral and emotional challenges in residential facilities. In our survey, we asked about a broad range of facilities, including the types that you've heard about today. We also visited 4 states. Today, I will discuss what we know about the extent of youth maltreatment in these facilities across the nation, what states are doing to protect youth in these facilities, and what federal agencies are doing to oversee state efforts. In summary, youth maltreatment and fatalities occurred in both government and private facilities all across the nation. However, we don't know the full extent of the problem because many states either don't collect or don't report data for all residential facilities. Regarding oversight, we identified gaps in state activities that leave youth in some facilities at greater risk of maltreatment or death. We identified similar gaps in federal activities. Regarding the extent of the problem, in 1 year, 34 states reported to HHS more than 1,500 incidents of youth maltreatment that were committed by facility staff. As you can see, hopefully, from the graphic above, the proportion of incidents related to physical abuse was 24%, to neglect or deprivation of necessities to 44%, and sexual abuse 9%. Officials in the states we visited cited factors such as a lack of experienced staff, insufficient training, or lack of appropriate supervision as causes. In addition, in our survey, 28 states reported at least 1 death in residential facilities. This next graphic shows that 16 states reported deaths due to accidents, 9 due to suicide, and fewer states to homicide and the use of seclusion and restraint. I should mention here, though, that deaths related to seclusion and restraint may also be categorized as accidents in some cases. It's important to note that these data are not complete. The number of adverse incidents is very likely more numerous and more widespread than reported for a number of reasons. For example, in many states, officials said they lack authority under state law or regulation to collect data on private facilities that do not receive government funds. And the HHS database I mentioned earlier tracks fatalities that result from maltreatment, but not from suicides or accidents, both of which may be an indicator of neglect or other problems. Regarding my second topic, state oversight. As you know, under the current structure, states are primarily responsible for ensuring the well-being of youth in residential facilities. To do this, they have a range of tools at their disposal, including licensing, standards, monitoring, and enforcement when violations are found. All states in our survey reported having some licensing processes. However, the types of facilities licensed and the licensing requirements varied from state to state, and we found gaps in the licensing activity. Most notably, state agencies often exempted certain types of facilities from licensing, and in particular, private residential schools and academies. This is worrisome because owners can self-identify the type of facility they operate. Therefore, a facility could bypass state requirements by identifying itself as a type of facility not subject to licensing. In addition, for those facilities that states did license, they used standards that addressed many but not all of the primary risks to youth well-being that you've heard about today. Almost all states reported that licensed facilities are required to meet basic standards such as the safety of the physical plant. However, about a third of state child welfare and health and mental health agencies reported that they do not require written suicide prevention plans. Once a facility is licensed, regular monitoring helps ensure that licensing standards are taken seriously and that risks to youth well-being are addressed quickly. However, officials in 3 of the 4 states we visited were unable to meet their goals for conducting regular site visits for monitoring at residential facilities. They were also unable to conduct unannounced site visits, which can reveal conditions that might not be seen during a regular announced visit. These officials cited fluctuating levels of resources and large workloads as factors limiting their visits. There are also other approaches to overseeing facilities. For example, some states required accreditation, either in addition to or instead of licensing as a condition of serving youth under state care. Finally, turning to federal oversight of state efforts. The Departments of Health and Human Services, Justice, and Education all have certain processes in place through their grant programs to hold states accountable for the well-being of youth in general. However, as with the states, we found gaps in their oversight related to residential facilities. For example, under current law, federal agencies do not have the authority to hold states accountable for youth well-being in private residential facilities unless those facilities serve youth in programs that receive federal funds. For those facilities that are under federal purview, federal requirements did not always address the primary risks to youth well-being. HHS, Justice, and Education all reported that they do not have authority to require that states have suicide prevention plans as a condition for receiving grants that they administer. Similarly, with one exception, federal programs also do not require that states ensure the proper use of seclusion and restraint practices in residential facilities. Federal agencies did not always include residential facilities in their oversight visits and have not used all of the enforcement tools available to them, such as financial penalties. In conclusion, the results of our ongoing study show that the current federal-state oversight structure is inadequate to protect youth from maltreatment and death at a time when they are most vulnerable. Given the wide variety of facility types and the variations among state laws, there are no simple solutions. Without meaningful data, state and federal agencies don't know the extent of maltreatment in their jurisdictions, so they cannot accurately assess the risk to youth in facilities or best target their oversight resources. And licensing alone holds no guarantees without clear standards, regular monitoring, and a full array of enforcement tools. The comprehensive results of our work will be included in a report to be released next month. This report will provide options for action that states, federal agencies, and Congress may want to consider in any restructuring effort. We also anticipate that our report will contain recommendations for action that federal agencies can implement now under the existing structure. Mr. Chairman, this concludes my statement. I would be happy to answer any questions you or others on the committee would have.